Hello, everyone. I'm Benny DeCecca, Chief Executive Officer of Validation Institute, and I'm happy to be joined by Amy Parekh, Chief Health Officer of Included Health. Hi, Amy, and welcome.
Hi, Benny. Thanks so much for having me.
So, Amy, I am super excited to have you here today because there is so many great things happening at Included Health, besides Included Health achieving an outcomes validation. So I'm just going to dive right in. Can I ask, why did Included Health choose to go through the validation process?
Yeah, Benny, thanks so much for that question. And as you know, just given your experience in this area, over the past decade, there have been dozens, if not hundreds, of health benefits companies entering the marketplace, from small point solutions to large navigators like ourselves trying to connect an ecosystem. And while we're flooded with marketing noise about how much savings all of these solutions can offer, the reality is many of them fall short when you actually go to look. Are they actually able to deliver the savings that they say they are? And so clients struggle to understand what's fact and what's fiction. So for us at Included Health, we know that measuring cost trend is critical, and we decided to go through this process with you all to provide our clients with some unbiased external validation that we can actually impact and measure, that our services are actually delivering meaningful impact. You guys are known for being unbiased in this space, and so we figured we'd be thrilled to do this with you.
Well, we're appreciative that you did do it with us, and we are very much unbiased, and the numbers are fantastic. So how is Included Health able to achieve the outcomes validated by Validation Institute?
Yeah, so very quickly, a reminder of what product package Validation Institute validated our savings for. You've validated Premium Navigation, which is our guidance and advocacy solution. It gives employees and their dependents sort of a single point of entry to healthcare. So it has a digital app, but also live support from clinicians and non-clinical care team members to make it easier to access and use healthcare. So the three things that y'all validated were: you validated our methodology for measuring trend. You validated that Premium Navigation delivered statistically significant cost reduction, and that groups with Premium Navigation had lower costs even above and beyond what clients of our other products were using. So this was really sort of the premium savings solution. So now how do we get there? So first and foremost, it's hard to drive savings if you don't engage a population. So, we are actually able to, with this product offering, truly engage nearly 40% of households in a population. And so that actually allows you to decrease the total cost of care. And then what we know is for the highest cost members, we have even better engagement results. So 80% of members who spend $100,000 or more engage with us in Premium Navigation. 65% of the population that ends up spending $50,000 to $100,000 in healthcare engages with us. So those types of engagement numbers allow you the ability to then decrease the total cost of care. So then the second question is, well, what are you doing with members once they're engaged? Because you can engage a population, but not drive savings. So what we believe drives our savings is that we're clinically engaging these members. So we're getting them into primary care. We're delivering expert medical opinion so that we change treatment or diagnosis plans quickly. We are actually doing care, case, and disease management for these populations. So it's truly we engage members at scale, and then we engage them clinically to actually have interventions that drive savings over time.
That's amazing and fantastic. And you mentioned the importance of clinically meaningful engagement. Can you share a little bit more about what you mean and why it matters?
Yeah, so I think most people will say most navigators decrease healthcare cost trend. But one thing that's been hard to do is say how much of it is dependent on what the navigator is actually doing, or is it because of other changes happening in the ecosystem, like change in benefit design or in the network that patients can access. So we've always had a very strong clinical bench. We've always hired clinicians, and by that I mean doctors, NPs, PAs, who can actually use clinical judgment to help deliver personalized care. So we've had that from the beginning. And so what we wanted to do was make sure when we did this validation with you, that was the why behind us actually delivering the savings. So as an example, we have a product called Provider Match. That's when we help people get to the highest in-network quality provider that's matched to them. So whether that's an orthopedic surgeon or a primary care doctor, we were able to drive over 100% increase in new high quality primary care relationships. And we all know that when you have a high quality primary care, you're going to get your preventive screening. You're not going to go to the emergency room when you don't need to. You're going to have somebody in the healthcare system who you trust and can go to first. Beyond that, we've delivered a number of expert medical opinions. Per expert medical opinion, that's a $9,800 savings. And so when you can actually get someone on the right treatment plan, change their diagnosis sometimes. So sometimes people think they have one disease, but they actually don't. They have something else that changes their entire trajectory. And then with care, case, and disease management, being able to engage 2.5 to 3 times the number of patients that are engaged in these programs from a traditional system has really driven the ability to manage costs in patients with long-term chronic disease and complex disease.
Oh, wow. And now that you've validated the financial impact of your navigation solution, what's next?
Well, I think you might know this, but one of the biggest things we've done recently is integrate navigation with virtual care. So we actually have on-staff primary care doctors, on-staff behavioral health providers, and 24/7 urgent care. And so the ability to actually not just navigate the existing healthcare ecosystem and make that higher quality, but actually deliver a bunch of the care, we think is going to be the next big stepwise increase in delivering outcomes and savings. And we already have 700,000 people live on it today. And so Benny, maybe soon you'll be validating the savings and outcomes in that sort of combination package.
Wow, that's great. And how does the validation just help differentiate Included Health from your competition?
Yeah, I mean, you know, almost all of the navigators out there have some savings validation out there. But what we believe is true for us is that we really took the approach of trying to get at causality instead of just correlation. So what is it that we are actually doing that's driving the savings? And for an employer, I think it passes the sniff test of, oh, actually, when you do clinically engage people, that should lead to savings, as opposed to some of our competitors where a lot of the engagement is administrative and financial things, which also, by the way, is great for member experience, is great for reducing the hassle of healthcare, but it's harder to drive the savings in those cases. And then very specifically, I think we're the only navigator with a post-COVID savings validation at this point. We know COVID changed healthcare. It totally changed how all of us access care. And so it's nice to have validation in today's world, which is post-COVID.
Well, one for one, it's great to be post-COVID, and it's amazing that you have statistics and you're already out in front of it. So that's amazing. Amy, again, thank you for being here today and providing us more insight into Included Health. And for everyone out there that wants to learn more about Included Health, I would encourage you to go to their website and download a report. It's got some amazing numbers and some very interesting statistics for you all to read about. So Amy, again, thank you very much and have a great day.
Thank you, Benny, and thank you for bringing unbiased validation to this ecosystem. It needs it.
I appreciate that. Thank you. Take care.